photos from Senator Warren's campaign. She is just out with her plan on paying for Medicare for all, capping her press release with the ultimate clapback to her critics in a new tweet confirming, "My plan won't raise taxes 1 penny on middle-class families." I want to bring in NBC's Ali Vitale and Mike Memoli, both in Iowa. Ali is in Des Moines for us. Listen, Ali, Elizabeth Warren has a plan released, it seems, almost every day. This one is a big deal because she has been hammered by her opponents on how she's going to pay for her Medicare for All plan. Now she's got an answer.
Yeah, Hallie, now she's got an answer. I never thought I would be describing a policy paper as hotly anticipated, but here we are in 2019 learning new things every day. And I think the simplest way to go about explaining what's in this plan is taking it in 3 parts. You've got the cost, how she's going to pay for it, and then the politics of it overall. So on the cost front, we were really looking at what's the number, what's the price tag that the Warren team is going to put on new federal spending for Medicare for All. We now know that that number is $20.5 trillion. And basically how they get there, because that estimate is lower than some of the other estimates for Medicare for All costs that we've seen, is they start making some pretty explicit policy decisions about how they want to go about implementing Medicare for All. Things like reducing the cost of prescription drugs aggressively, getting at the cost of care and trying to take those costs down as well. All of that factors into how they get to that $20.5 trillion number. And then on the pay for it side, you mentioned that it's the ultimate clapback to her critics because in this plan, they say that they're not raising middle-class taxes by even 1 penny. What they are doing, and this should come as no surprise if you've followed Elizabeth Warren at all on the campaign trail, is they're talking about raising taxes and levying these taxes on investors, the top 1%, big corporations, all the people that Elizabeth Warren regularly talks about needing to pay more into the system. That's a big part of how they plan to pay for that $20.5 trillion. And then you just look at the politics of this moment, Hallie. You call it the ultimate clapback, and really it is, because it allows Warren to come off her heels and start going on offense on this question of, A, what her health care plan means for the middle class, but B, how she's going to pay for it. And in this plan, she says something interesting. She says, we need plans, not slogans. That's clearly a challenge to the rest of the field to, A, show their work, how they want to pay for their own health care plans, and B, come at her, challenge her on these, because she put the numbers right in front of us.
So let's talk about what some of those opponents have said, Ali. Here's a little trip down memory lane for the criticism that Warren's been getting really for the last several months on this. Watch.
At least Bernie's being honest here and saying how he's going to pay for this and that taxes are going to go up. And I'm sorry, Elizabeth, but you have not said that.
She's being vague on the issue of, actually both of them being vague on the issue of Medicare for All.
No plan has been laid out to explain how a multi-trillion-dollar hole in this Medicare for All plan that Senator Warren is putting forward.
So now she has a response to that, Ali, but there are some assumptions that are kind of baked in to the way that she's looking at this moving forward, right? Yes, no, she says no taxes on the middle class. The rich, the wealthy corporations, they're going to get hammered. But she's taking into account things that we don't know will necessarily happen yet. Is that a fair way to put it?
That's a fair way to put it. There's definitely assumptions baked into this policy cake that haven't yet come to fruition. One of the things that it assumes, for example, is that immigration reform will pass and that several $1 billion in revenue will come in from that. Of course, we know that that's been an issue that Washington's been contending with for some time. Another thing that's kind of baked into this cake is they assume that the Trump tax plan tax cuts have been repealed. And so, of course, there will be differences in the tax rates for Americans across the board if those tax cuts are repealed. But that's something that the Warren team says she's supported even before coming out with this plan. I think the real thing here is that outside experts will have something to wring their hands over, the assumptions in this and how feasible it'll actually be to implement. But the reality politically is that Elizabeth Warren has been able to answer the question that all of her opponents were putting at her while doing exactly what she said she was going to do, which is keep costs down and not raise taxes on the middle class. They were able to reach their goal by making some actual specific policy decisions in this health care plan that I think a lot of the field was kind of waiting to see if they would go super vague on it or if they would really drill down on the specifics. And 60-plus pages of a plan later, I think we know the answer to that, Hallie.
Ali Vitale live for us there in